Welcome back, Bread and Butter Primary Care. I am Dr. Stokes, and we are talking some more about diabetes today. And today's video is pre-diabetes. What is it, and why do we care? So we hear this term a lot. If you're a patient watching these videos, you may have been told, "Oh, you don't have diabetes, you have pre-diabetes," or maybe you're on your way to diabetes, but you don't have it yet. So we're going to talk a little bit about how that's defined and what, if anything, to do about someone who is pre-diabetes. So the term pre-diabetes is a term used for a person who is progressing towards becoming a diabetic, but their numbers don't qualify yet. There's videos already about how to diagnose diabetes. If you remember, you have to have a fasting sugar above 126, an A1C above 6.5, a random sugar above 200 with symptoms, and that's how you diagnose diabetes. There is a window period, especially with the A1C, before they get to diabetes, when they're not normal, but they're not diabetes. So the A1C is considered normal if it's 5.6 or less. People who have very healthy will have A1Cs down around 4, and up to 5.6 is normal. 6.5 is when you say someone has diabetes. So there's this window between 5.6 and 6.5. And that's what we call, people in that range, we call pre-diabetes, glucose intolerant, insulin insensitive. Those are all words that we use for that, people in that bracket. And so if you've been told that, that's what they're saying, that you had a blood test done, your sugar level is not normal, but it's not high enough to be considered diabetic. So what does that mean? Why do we care? Pretty much it means that you are an individual, that if you live your lifestyle in a certain way, you will have diabetes. You have the propensity to get it. So that's why you're kind of pre-diabetic. We care because it's an important window in which you can start to intervene and actually prevent people from becoming completely diabetic. And so it is an important time. And so what do you do if you have a patient, they came in, maybe they had symptoms, maybe they just wanted screening, you did some labs, and you discovered that they have an A1C, let's say, of 6.0. And so you say, okay, you have pre-diabetes. So first off, lifestyle management. And so these are excellent patients to say, hey, you don't have diabetes yet, but you could have diabetes. If we get you eating the right things, if we get you doing the right activities, you could never have diabetes. If you do the wrong things, you likely will. And so it's a good motivating kind of place to be for patients to think, hey, I could still prevent this. And so that's number one. Pre-diabetes, you want to recommend lifestyle changes. There's a video all about lifestyle changes for diet and exercise, but reduction in carbohydrates, reduction in calories, increase in aerobic activity can all be very, very helpful for people who are pre-diabetic. As far as medication management of pre-diabetes, I've seen a very wide range of this. I have seen some endocrinologists who are very aggressive even in the pre-diabetes state. Generally speaking, the only medication that is recommended for someone who is pre-diabetic would be metformin. There are some studies that have shown that it can help prevent the progression to full-on diabetes, and so that's an option. I like to present that to patients as a shared decision-making process that we go through. So oftentimes what I'll tell patients is, your labs came back and you have what's called pre-diabetes. Your sugar's elevated, but not enough to be a diabetic, but you could be a diabetic someday. We can prevent that from happening with lifestyle changes, changing the way you diet and exercise. There's also a medication called metformin that has been shown to help prevent that progression. And some people are the type that will say, if I don't have to take a medicine, I don't want to take a medicine, I'll do all the lifestyle stuff, I want to avoid pills at all costs. Some people will say, my dad's a diabetic, my mom's a diabetic, my whole family's a diabetic. If there's something I can take to prevent me from becoming a diabetic, I'm all in, please give me the medication. And so it's a conversation that I have in which the decision is reached whether or not to put metformin on in the case of pre-diabetes. So definitely lifestyle management, and then conversation about metformin if that would be the desired. And then you monitor, give them 3 to 6 months, come in, check again, see if it's stable, decreasing, increasing. And then as you check in again, it gives you more opportunities to reinforce the dietary changes and those types of things. And so that's what prediabetes is. So it's this window between 5.6 A1C and 6.5 where they're not diabetic yet, but they might become that. And it's time to institute lifestyle interventions, have a conversation about metformin, and hopefully help that person prevent them from becoming diabetic in the future. Have a great night. This is Dr. Stokes for Bread and Butter Primary Care.